everything works. Okay, welcome everyone. I should introduce myself. I'm Leslie London, head of the Public Health Medicine Division in the school. I'm pleased that there's such a big turnout so early for our seminars. Thanks also to David Sanders, who's here from UWC, who's also a participant in this project, which I'm going to be presenting. We have a lot of technology going on, so if things get paused in between to sort out technology, which I hope it all goes well, just bear with us. So I'm going to be speaking about this topic of a corporate health impact assessment and its relationship to health equity. As you can see, it's a collaborative project with a lot of partners, principally actually through the People's Health Movement and the participants in the People's Health Movement who are based at different universities, and you can see the full list there. And David, who's here from UWC, was a driver in that project. And it really revolves around this publication, which was published in Globalization and Health, which summarized the thinking of this group of partners around how to think about addressing the health impacts of transnational corporations. And the reference is there, and I'm happy to circulate. And I'm basically going to be speaking to why we approached it in this way and what the framework provides. I'm not presenting any case studies because that's still in the process at the moment of being developed. So we know that transnational corporations are incredibly powerful, have immense impacts on health and health equity. They're estimated to be over 100,000 transnational corporations globally, and some of them have larger economies than entire states. Of the top 100 economies based on revenues, 2/3 of them are transnational corporations and 1/3 are governments. So this is from the publication. It might not be entirely clear, but it's a sample of revenues for different organizations, including governments. And you can see here South Africa. So we just picked up the post by Walmart. But if you look, you know, Peru, Greece, Romania, down to Bangladesh, it's probably slightly smaller than Verizon, Hewlett-Packard, JP Morgan Chase, etc. So it's quite clear that transnational corporations are very powerful, and yet the World Health Organization is an organization of ministers of governments, but yet we have very powerful economic influences and political influences as a result outside of those processes. So public health really lacks the tools to assess the impacts of these kinds of organizations. We look at what governments do quite a lot. The World Health report comes out and gets audited by PHM. That really focuses on what governments are doing. We tend not to look at how corporations impact on health, and we need tools. And it should be said that there are both positive and negative impacts, but certainly what we need is tools to enable us to mitigate any adverse impacts and take advantage of positive impacts. So the research evidence that led to this meeting was partly around the idea that transnationals can contribute positively. For instance, the investment can promote employment, can improve working conditions, education, infrastructure, health service provision in some contexts, and that voluntary contributions, so corporate social responsibility, those kinds of things could be targeted at reducing environmental impacts and promoting social accountability. But we also know that transnationals undoubtedly have negative impacts. Dick Freudenberg, writing about primarily the food industry, published a very interesting book recently when he talks about this idea that over the past 2 decades, the economic arrangements in the world have been increasingly changed to suit the needs of corporations rather than countries. And so we've set the stage for this 21st century epidemics, as you've seen the rise of obesity, for example. There's also many examples of transnational corporations being associated with implementing very hazardous working conditions in developing countries where employees are not protected in the same way that employees in their home countries would be by regulation, low pay, pollution of so-called unsullied environment, harmful products. Those of you who wrote the environmental health policy module on our NPH will know that we quoted Larry Summers, the former World Bank president, who infamously made the statement that developing countries are basically underpolluted, and it makes economic sense to basically transfer hazardous waste to them. That is a highly discredited comment, but you understand that there is a great adverse impact from harmful pollution. The UN Special Rapporteur on the Right to Food commented about the global food system, which is run largely by transnational corporations. He calls it a public health disaster. And the Commission on Social Determinants of Health commented about trade agreements and the link between trade agreements and increasing power of transnationals, along with the mobility of capital, have reduced the country's capacities to regulate, basically, to ensure that economic activity doesn't undermine health equity. And then, of course, the Lancet Commission on Global Governance a few years ago highlighted the importance of transnational corporations' influence and their ability to influence global governance to further their own interests. So here's just a couple of examples, and I'm afraid it is true that the list of positive ones is shorter than the list of negative ones, but they're just illustrative. So if you think about it, in South Africa, the mining industry was providing antiretrovirals during a period in which the state was denying treatment for people with HIV. Mars Bar apparently has initiatives around sustainable cocoa development, Nestle adding food fortification, and BHP Billiton strengthening local supplies in Chile. But on the negative side, we know that in South Africa, Big Pharma sued the South African government around reducing drug prices a few years ago. Coca-Cola was exposed as polluting groundwater in India and depleting groundwater. There was an outbreak in the US related to contaminated dough at Nestle, a national outbreak. Bhopal is famous. We know there was a methyl isocyanate leak that killed and disabled thousands, and we're still living without adequate compensation. Big Tobacco is constantly seeking litigation against small countries to try and roll back the gains made under the Framework Convention on Tobacco Control. Tax avoidance by McDonald's and South African breweries, our own South African breweries in Ghana, been documented. BHP has dumped tons of waste, actually, not water, into rivers in Papua New Guinea. And we know the pharmaceutical companies' suppression or misrepresentation of research findings so that they can promote their sales. So in South Africa, that's a slide of asbestos waste in the Northern Cape. As you know, the case against Cape Asbestos was finally won and compensation was secured, and that set up the Asbestos Relief Trust. But much of the rehabilitation of those dumps is basically left to the DME, Department of Mineral Energy and Department of Environmental Affairs, so taxpayers actually carrying the cost of that. That is a paper bag for genetically modified cotton from Makatini Flats, where small farmers are growing GM cotton. South Africa has the highest penetration of GM in its staple foods. So 70% of our maize is GM maize with very little transparency. And the health impacts of that are really undetermined because we don't know, we aren't able to characterize the long-term risks. But industry has been able to influence the regulatory environment to promote widespread access to its products. Here's another example. You might be familiar with the company Mining Resource Corporation. It's an Australian company which was linked to a South African subsidiary in Kolobeni on the south coast, on the east coast, Old Transkei, where they are trying to mine dunes for titanium and other precious metals. Community is very opposed to it because they believe it will interfere in their traditional way of life. There's been a lot of conflict, a lot of violence. There was an assassination of one of the community activists. Anyway, this case involves a summer school which was held here at UCT, which was on the extractive industry, and those two lawyers, the two women in front, came to talk at the summer school, along with the community activists. The Australian company, even though it's supposedly withdrawn from Kolobeni, has now sued them for what they said in class during a lecture for libel, and including the activists. So this is what's called a SLAP suit, a strategic litigation something APP suit. So companies use this to damp down any opposition to their activities in this way. It's quite clear what they're lawyers. I don't think they would have defamed a company if they're either very stupid lawyers. But they obviously said things which were critical of the company, and the company is using this now to suppress any opposition. So these are other ways in which transnational corporations operate with adverse effects. So for these slides, I want to thank David for lending them. I'm going to talk a little bit around obesity in South Africa and some of the evidence. So we should all be sitting down at this point because these are astronomical rates of diabetes. It's been confirmed in the Sand-Haynes that we've had incredible rises in the rates of diabetes in South Africa. So you can see for men in this age group, rates approaching 40%, and almost all age groups, it's much higher in the recent years compared to previous surveys. These are rates of obesity and overweight, and you can see for men and women the rates are going up, and including for children, actually. And this is very worrying. And so we have this incredible obesity epidemic unfolding, and some of the reasons might be related to what we eat, of course. And high fat and high sugar intake is pretty ubiquitous, as confirmed in Sand-Haynes. And the reason why we have high fat and high sugar intake, well, might be, it's not just a matter of personal choice. So here's some data. So we are world leaders in consuming Coca-Cola. We went up from about 130 Coca-Cola products in 1992 to almost double in 2010. So we consume a lot of sugar-sweetened beverages, and this is all part of the motivation for introducing sugar tax. And this might be a bit small, but if you look at changes in volumes of sales, you can see that ready meals, snack bars, noodles, basically processed food is on the up. So the reason why our diets are so bad is not just because we like Kentucky Fried Chicken, or we choose to eat it, but there's a whole context for marketing and availability in South Africa. And of the top 10 companies in South Africa, 1, 2, 3, 4 are non-South African companies. Five, okay? So Unilever, Parmalat, Nestle, Cadbury, Pepsi. Okay, so we have a big global impact on our economy and our food patterns and our consumptions. And the value of imports of processed carbohydrate, Tim Noakes is right on one point here, that in fact our diet is changing. Our diet is changing because of what we're eating and the fact that trade is now changing the patterns of what we eat. We're importing huge amounts of these kinds of foods now. And what does it mean for ordinary people? Well, this is work David and colleagues did in 2 rural areas in the Eastern Cape, showing that people are now buying at supermarkets. They're not growing their own food, and they're not buying from small stores, or they're not buying from people who grow their own food. They're buying processed food from supermarkets, which are now reaching out into the most rural parts of South Africa, which are still the poorest parts of South Africa. So poor people are buying unhealthy food at high prices from this distribution chain. 2/3 of households in rural areas are now buying their staple foods from supermarkets. If you look at Cape Town, this is Jane Battersby's work, supermarket distribution in 2003 and in 2013, and you can see visually how it's been densified, and not just in affluent areas, but in many poorer areas of South Africa where people's diets are poorer already. So a quote from the World Commission on Social Determinants on Health, WHO Commission: trade policy that encourages unfettered production, trade and consumption of food high in fats and sugars to the detriment of fruit and vegetable production is contradictory to health policy. So in the area of food, it's quite clear how transnational companies' practices might impact on health. So if you need to think through these issues, Bellagio is a good place to go to think through the issues. So a group of people who researchers, activists got together in Bellagio, and that's Lake Como. Bellagio is. It's a Rockefeller Center where you can apply basically to get a sort of residency for a group of people to work on a project, and that's what we worked on. I think it was a 3-day meeting, David, but I can't remember. 4, okay. to work out how we could approach this issue of health impact assessments of transnationals. And the three questions that the meeting sought to address was, would it be useful to do so? Is it feasible to do so? And if so, how would we do it? And I think for different constituencies, there are different values. So for civil society, having a corporate health impact assessment tool would enable them to undertake advocacy, and particularly undertake advocacy that could empower communities who are facing challenges from the operations of transnational corporations. For corporates, and there were some members in the group who were from the corporate world, it was also said that it would be beneficial to improve practices to reduce adverse impacts and harmonize across countries, because corporates are also under pressure for social responsibility. They have to answer to their shareholders sometimes. Not all corporates, obviously, but there is some element of that in the corporate law. Governments clearly need to make regulation and policy that's going to achieve the appropriate policy objectives for their countries. And for the researchers, there was the set of questions around better understanding sort of the pathways for how transnational corporates impact on health and those relationships to health equities, understanding the pathways, and then also understanding how national and international regulations can impact on those transnationals and what they do and how they do it. And then obviously that provides a basis for generating evidence for public policy. So that's what we set out to do. Some of you in the audience might be familiar with health impact assessments. And this is the standard approach. There's been a lot written about it using the standard format of the sort of 6 steps approach. It's widely used to support evidence-based decision-making. It tries to make sure that social, economic, and environmental factors are taken into account in that decision-making. You can do it retrospectively, so-called ex post. In other words, you look at a policy or a program and you look back in time and see how has it impacted, and you use that to change it going forward. Or prospectively, in the sense that someone's producing a new policy. So, for instance, a new energy policy in South Africa, which we should be doing, there should be some kind of impact assessment going forward to shape it in the best way. And the 6 steps are firstly a screening, which is about determining whether a health impact assessment would add value and will it be useful. And scoping, in other words, what health impacts would be considered and what populations would be affected, and that essentially was what we did in Bellagio. And the 3rd step is to identify the current and predicted health impacts, as both positive and negative, and what changes may occur. 4th step then is to make recommendations designed to promote health, then communicate the findings, and then finally to review whether the health impact assessment changed outcomes. So that's the standard approach in the literature around HIAs. So what would a corporate health impact assessment bring that would be different? So the one thing that we discussed in quite a lot of detail is that under globalization, the value chain stretches across countries, it stretches across the globe. So what happens in Mozambique is deeply influenced by where the parent company is and where the products go. And this would enable us to get a much better understanding of the value chain. Because often we look at a problem where countries are constrained by their national limitations, and in fact, they're either choosing or they're unable to do differently when it comes to regulating corporate activities. It also means you can compare across countries, and you can also compare across transnationals. And this also brings a specific health equity focus, so you're able to look at the differential impact of what happens. So I'm going to try and sort of go through this. I hope it's clear. So the conceptual pathways, if you start by thinking about the enabling regulatory environment for transnationals, there are very strong arrangements that promote free trade globally. We know the World Trade Organization, we know powerful countries negotiate bilateral or trilateral agreements. So they're very powerful free trade pressures globally. There are taxation regimes which differ across countries, and quite often corporates, transnationals are encouraged to invest by means of tax-free zones or export processing zones, those kinds of things. Even though the ILO has standards They are quite permissive, so there's a lack of a universal labour law. So conditions of service in South Africa are determined by our Basic Conditions of Employment Act and are very different from conditions in just across the border in neighbouring countries, even though there's an ILO convention which is really about the principles. Environmental laws similarly are quite inconsistent. So we have global conventions, Stockholm Convention, Rotterdam, etc. But a good example might be the fact that South Africa has banned asbestos in South Africa, but at the last Rotterdam Convention Conference of the Parties, South Africa was going to support Zimbabwe in opposing a change in the way in which chemicals were added to their convention's listing, which would have made asbestos one of the scheduled chemicals under Rotterdam to be completely phased out. So these inconsistencies in environmental laws remain a problem, and very strong intellectual property protections globally. So the World Intellectual Property Organization and intellectual property rights are very strong and often much stronger than human rights obligations of governments, because they have penalties associated with them. If you breach copyright, you breach intellectual property. Transnationals, corporations also can sue, so they have legal personhood, and that's, for instance, the example of MRC suing the lawyers at the Centre for Environmental Rights. Corporates have an unlimited lifespan, unlike people, and shareholders can exercise some input, but have quite limited input and actually have limited liability. So, in fact, when Thor Chemicals poisoned workers in Cato Ridge, which was basically a plant which was kicked out of the UK because it was too poisonous to have, they broke all their regulations, so they basically brought it to KZN, set it up as supposedly a reprocessing plant, but essentially it was a waste processing plant, and exposed large numbers of seasonal workers to chromium, a number of whom died, a number of whom were poisoned. The final outcome, nobody was held responsible. The managing directors got off totally, and there was no shareholder liability for that, but people made profits from Thor Chemicals at the end of the day. So if we start with that, how do we get to the negative health impacts? Well, that creates the Transnational Corporation entity, and then its practices are really critical. So the way it markets its products, so the products themselves might be harmful, or the way it markets its products might be harmful. The way it targets particular populations might introduce elements of inequity. The suppressing of public health messages, we see that a lot in the current engagement around the sugar tax, around alcohol, tobacco all the time. There's a big discussion now about smokeless tobacco. Should it be regulated? Is it harmful? How do we deal with that? So a lot of this misinformation around public health messages. The discrediting of critics, it's quite common that people who are critical of industry eventually become themselves targets. So I'm on an editorial board for a journal in occupational environmental health field that's just had its editor, I wouldn't say sacked, but his contract was ended without any explanation, and a new editor was appointed who was much more sympathetic to industry, and none of the editorial board members were informed, and his paper was actually revoked. The paper that he had published in the journal was actually retracted, which is more or less unheard of. So a lot of implicit discrediting of the science behind criticism. Engaging front groups, we've seen that a lot. So we'll see groups that purport to be part of civil society, but they're actually funded by different industries to present industry views. The direct influence of research, so setting up research agendas or providing support to certain kinds of research. Corporate crimes, so fraud, corruption is an issue, and abuses of human rights. And then the way transnational corporations influence government through influencing the taxation regimes, holding up regulations. The Department of Health has brought out regulations on to control alcohol advertising. Those regulations have had 2 regulatory impact assessments done and a socioeconomic impact assessment, and they haven't seen the light of day. They are still stuck somewhere in the government process. So basically, industry is powerful enough to influence these regulatory processes to slow them down. or to change them to bend regulation. There's often the promise of many jobs. That happens all the time. The idea that they would contribute to food environment and they would adversely impact the food environment, as has been shown with the supermarket data, impacting on the natural environment, and also on medical systems. So in the pharmaceutical and technology environment, there's obviously a high influence. So that would be the negative pathways. And this is actually a report done by Action Aid in 2005. It's actually a fantastic report if you can get to it. It shows how South African breweries bought up Accra breweries in Ghana, and the entire operation of South African breweries in Ghana pays less tax than the vendor who is selling their products across the road. She has to pay value-added tax on the products she sells, and she pays more tax than the entire company because they have basically siphoned off all their profits to a holding company in Switzerland and managed to basically declare almost no tax. And that's legal. So it's not illegal, but essentially it's immoral. It's sort of, in a context where Ghana is trying to fund the national health insurance, it's a way of actually undermining the health system. So to be fair, we have to also acknowledge that there are positive pathways in many ways. So here we have the TNC entity. So corporate social responsibility exists for what it's worth. There are many people who are critical who say that actually the existence of corporate social responsibility helps to perpetuate all the negative consequences because it's seen to be a defense. There are real ethical trade pressures, but so consumers in the north can exert pressure, and we've seen that in South Africa. So recently there was a documentary on conditions on farms in Robertson. Some of you might have noticed, Bitter Grapes it was called, caused a great outcry, and actually the Swedish buyers of South African wines cancelled their purchases of South African wines as a result of that. So there is pressure put on producers to change what they do and their work business practices. Shareholder activism, so a single shareholder can ask an embarrassing question at a shareholder meeting and produce some kind of positive outcome. There are transnational corporations that do invest in their workforce, see them as a positive contribution, and have a strategic understanding of how to do business in a changing world. And some who do see community responsiveness as essential to their work. So again, their influences then can be in a positive sense, impacting on health equity. Okay, here's just to make the point that the mining industry in South Africa did produce the biggest antiretroviral program at a time when government was denying it. So when we think about tools to look at transnational corporations, there's three levels. So there's the context, which includes the history of the transnational corporation, understanding where it came from. The operations at global level, so looking at the supply chain all the way from production through to distribution, marketing, and then finally consumption. The effect of the global regulatory environment, which could include those trade agreements outside of the UN, or financial regulations, or UN treaties, conventions. Then, of course, there's the national context, and there some quite critical elements of those links between the political elites at the national level and the transnational corporation. The national regulatory environment, which might be quite weak. It really depends on having people with good skills, able to use evidence to translate that into regulation in an effective way, and not all countries or contexts have that. Corruption, okay, well, we always get reports about where we stand on Corruption Watch, and we don't stand too well. We might not be the worst, but to ask average South Africans, they might think that we are a very corrupt country. Industry association activities, so we've seen that quite strongly in many different ways. And then, of course, the response of communities and groups affected by transnational corporations is important. Then in the way the transnational operates, both its structure and the way it practices are really important. So there might be issues related to the organizational structure of the corporation, the fact that SAB can siphon off its money to a Swiss company is related to how it's set up that company in Ghana. Political financing and lobbying practices. I see political parties in South Africa appear finally to have agreed that they will declare who funds them, but that's been a bone of contention for most political parties for a long time. Business practices, including board memberships and business affiliations. Okay, so our deputy president was on Lonman's board at the time of Marikana, and you can disagree with that, but it's quite clear that there was influence in the way the state dealt with the strike, which came from Lonman, and he was in a decision-making position at that time. He of course, denies that he did anything like that. Vincent Mapai, who is also politically very well connected, is not in cabinet, but has a long history with the ANC. He is executive, one of the directors for South African breweries. At the time, he was also on the National Planning Commission developing the National Development Plan for South Africa. So you can understand that having powerful people in powerful positions will enable certain kinds of relationships to form and certain kind of influence to be permissible. Corporates also use EIAs and HIAs and corporate social responsibility in their practice, and as I've said, that's both a positive and a negative thing. Philanthropy and sponsorships is a big issue. So here, South African Breweries Social Innovation Award and Disability Empowerment for 2017. And then, of course, there are the actual product harms that, depending on what they produce. So if you're an insurance company, well, maybe insurance is bad for your health, but you know it's less harmful than tobacco or alcohol when it's excessive, etc. Here's an example of a billboard that was actually up in Woodstock as you come over the bridge from the N1. This one's, I don't know if you can see, it says Grootman of Lighty, and it's not very clear, but vra vir die volle, ask for the full 750 ml. In other words, you're a pipsqueak if you don't ask for more. Okay, so it's very clear it was encouraging people to drink large amounts, and it was targeting young people. You don't want to be a lighty, that's sort of a pipsqueak. So in the way multinationals operate, they can target vulnerable populations. We know that drinking rates in young black women in South Africa are relatively low, and that's a market area. And SAB now and Hauser InBev is targeting expansion into Africa, and particularly so-called under-subscribed sectors. So the health impacts could be mediated through the way work happens, so the working conditions. And in general, multinationals can have better conditions than local companies because they have more capital at hand. And it is the case that for many countries, conditions for workers in big companies might be better than local companies. Not always the case. But the social conditions are really important. So the impacts of the goods on locally produced goods and services, and we see that in the food sector quite clearly. What people are buying to eat is not what local people are growing or developing, but it's actually what comes from these top 10 packaged food companies. And that changes the local economy as well, because the money then doesn't stay in the local community, but it heads out somewhere else. When Walmart came into South Africa, the unions were very strongly opposed because of questions of employment and local supply. The Competitions Commission had an agreement, and eventually Massmart, Walmart were allowed to come in. But that's a real issue, because what will happen, it's unlikely that employment will stay the same. It's certainly not going to get any better, because they'll introduce efficiencies and lower costs and draw on the international markets to undercut local labor. Some of the operations will impact on local living conditions. You can see that at Kolobeni, the local community rely on traditional way of life, they rely on tourism, but this is going to bring in roads, it's going to bring in construction workers, it's going to bring in pollution, and it's going to disrupt the kinds of life people have locally. You can argue whether it's better or worse, but the local community voice says it's worse. And somebody who said it was worse got assassinated, so it's no joke. The impact of transient workforces, we know that many of these multinationals are running operations based upon limited natural resources, extracting those resources. When those resources are done, what happens afterwards? The asbestos mines are the most extreme example. There's no rehabilitation paid for by Cape Asbestos because Cape Asbestos doesn't exist anymore. The shareholders have all got their money and everyone's closed shop. But the burden is left with the local community and then falls to the state, which has to pay for it out of taxpayers' money. For instance, the question of fracking, if you follow what's happening in the US, you have these boom or bust economies. So when fracking comes into a rural community in Philadelphia, a lot of money flows in, a lot of jobs are created. People buy, according to what they think the wealth will be, but that resource runs out. Or, alternatively, the global market for oil takes a downside, so oil becomes cheaper, so fracking becomes more expensive. So there's a slowdown in fracking. And so what happens in a local community, you have no control over it because it's all globally integrated. And of course, the impact on cultural norms, McDonald's in China, etc., and migrant labor itself has many hazards, as we know, in South Africa. The impacts on the natural environment, then, of course, will have consequences. The fishing industry has seen that a lot. And, of course, the impact on consumption patterns and diet is a very good example of that. And then the economic pathways, if you are able to send your profits out of the country without paying tax, well, that's a lost opportunity for the government to provide services to people. There's also economic dependence. Many people, once they establish, will say, well, we can't survive without this transnational corporations. So small countries whose economies are smaller than those corporations will become dependent. And then there's the displacement effect on local businesses and local producers, local farmers. So this, I'm afraid, is probably illegible, but it's in the article, but it's basically summarizing that framework of going from the political, economic, and regulatory structures at global, national, and subnational levels to looking at those structures, practices of the transnational corporations, and then understanding the health and equity impacts. And I went through those briefly. And then obviously coming up with an analysis of data to look at overall what the impact has been. So the framework was actually piloted by Frank Baum and colleagues in Australia, looking at McDonald's in Australia. It was also published. The project is hoping to get funding from the Australian Research Council to do work on 2 cases in the food sector and in the extractive industries in different regions. And we'll basically approach this from the point of view of an HA, but looking at it along the whole spectrum of the value chain. So I won't go into this in much detail, but basically to say that the methods are going to involve these kinds of approaches, stakeholder interviews, looking at it in the index country as well as looking at it in the upwards up the value chain, comparing across countries in that way. So I hope I've convinced you that transnational corporations have powerful effects on health, which can exacerbate health inequities. They're basically mediated through their practices, whether they are business practices or political practices. We need a regulatory environment to manage them, but transnational corporations also strongly influence that regulatory environment, usually to their benefit, almost always to their benefit. The impacts can be felt immediately on the employees, on the communities, and on the environment. And we need those tools, and I hope this project is going to be able to develop those tools to characterize the impact pathways and the remedial policies needed. Ultimately, this has to be linked to a process of reducing economic inequality and promoting social justice, and hopefully we'll be able to provide it for use by corporate, civil society, and governments. Okay? So thank you very much, and open for questions.
Thank you, Leslie. Are there any examples of these regulatory frameworks around? Any countries that have successfully managed to regulate TNC activities?
Well, usually they'll regulate some particular aspect. There won't be a regulation for TNC, but they'll introduce a sugar tax in Mexico, for instance, which essentially is regulating corporate activities or tobacco regulations. So the Mexican sugar tax has been successful to the extent it has been. We've seen that evidence. In Uruguayan government has been very strong on tobacco regulation, and big tobacco took them to court over that. And actually the courts ruled in favour of government and the Framework Convention. So it's not easy, but there are examples.
And nothing as comprehensive as what you're proposing.
Well, this is not a regulatory framework, it's a tool to inform regulation. So it's really providing the evidence for governments who are willing to take that position. David.
So just to, I mean, Leslie didn't, he skimmed over it, but unfortunately this project is not yet funded. We have an application in with the equivalent of our MRC in Australia, and on the first round we were rejected, but we got a very high mark. So we responded to the reviewers' comments, and we're hoping that we will get funded. If we don't get funded, obviously we won't just drop it. We will explore other potential funders. So just to give a couple of concrete examples to illustrate this rather bleak picture a bit more. So you all know about the Ebola epidemic. I'm sure you've read about it, but I'm not so sure that many will have looked at the political economy of the Ebola epidemic. So here's just a few tidbits. So Sierra Leone, Guinea, and Liberia are amongst the 10 poorest countries in the world with very weak health systems. But you probably didn't know that in 2014, the year of the epidemic, Sierra Leone had an economic growth rate of 20%, which was, I think, the world's highest at that time. That its mining sector contributes 60% of exports, but only 8% of government revenue tax. Top 5 mines use tax havens, and only one of the major mining firms was paying corporate income tax. So when a country like that is deemed poor, is poor for its citizens, or has very weak health systems, it's not just because there might be corruption in the country, which there is, but also because the country's being fleeced. It's not getting a fair deal for its product. And some of it is legal, as Leslie said, what companies do, and it's been shown with Lonman here by AIDC. If you just look at AIDC on the internet, you'll find a very interesting case study where Lonman has managed to avoid tax in South Africa by having a subsidiary listed in, I think it's the Bahamas, and it's just a post box. So it is being charged by this post box very large amounts for services rendered by a subsidiary. Therefore, it declares only minimal profits because it's paying its subsidiary a lot of money. So these kinds of ways in which TNCs avoid paying taxes really need to be exposed. So there's been a little bit of discussion about how, I think it was Google, is listed in Ireland because the tax it has to pay is much less in Ireland than it would have to pay in the country in which it is based. So these are ways in which actually we, as citizens, and especially in poor countries, are being robbed. So just finally, at UWC, we have a new research project starting, which is kind of not nearly as big as this, doesn't have the spread, but we're looking at the drivers of the obesogenic food environment in South Africa. In other words, why is it that, well, we know in general, but why is it, what's the detail behind why our diets here, especially for the poor, are increasingly made up of processed and packaged foods. So it's not just sugar-sweetened beverages which are driving obesity. Actually, it's more processed packaged foods. You know, biscuits, other confectionery, ultra-processed bread, processed meats, and so on, which if you go to any supermarkets in townships, actually occupy much more shelf space than they do in that same supermarket chain in those areas. So if anyone here is embarking on a PhD or looking for a PhD subject or even a master's subject in this area, come and see me, because we do have projects and sub-projects within this. And lastly, if you haven't heard of a fellowship program called Tekano, Tekano, there's a last-minute call for applicants for fellowships in the area of health equity. Tekano.
Thanks, David. Andrew?
Thanks, Leslie. My question is, there are many lower middle income countries don't have the resources and the capacity to regulate efficiently these TNCs, which is what you're highlighted. So they rely a lot on the companies' product stewardship programs and self-regulation. So would your tools take into account of how these, how countries can also assess when a company has product stewardship or a self-regulation program? Because often it's very glossy, they say the right words, and it gives the indication that they are doing the right things and regulating. So I would see that as an area that also needs to be evaluated.
Sure, that's interesting. So, I mean, it would certainly document what is happening in the regulatory space, which would include unpacking how regulation happens, and what you're describing is quite common, that regulation happens in a kind of informal way because states lack the capacity to do it in a formal way. And I guess for the case studies, it would drill down to looking at the content of that regulatory action, whether it actually makes a difference or not, whose benefit is it serving. But it's not always the case that countries don't have the capacity. So the reasons why they don't have the capacity also need to be interrogated. So the fact that nobody with the appropriate skills remains in the public service is a function of the salaries paid in the private sector versus the salaries paid in the public sector, which are political choices as well. There was a very interesting paper by an Indian academic actually talking about something called the, how did she put it, the cunning state. The state sometimes says it doesn't have the capacity to do something, but other times it actually does something quite strong. And it's a political choice about when it does that. So it might say we don't have the capacity to regulate, but meanwhile, if sort of human rights expectations are being loaded on the state, they say, no, it's our business, national sovereignty. So it's a complicated business, I think. Any other questions?
But just to add to that, so it also depends on how, I mean, obviously it depends on capacity, but it also depends on how a country conceives the problem. So, for example, in the food sector in South Africa, there are environmental health practitioners who run around and regulate food safety. Okay, so they will go to food outlets in both formal and informal sectors and spend quite a lot of time taking samples and looking at the safety of of foods, including meat and so on and so forth. However, there's very limited capacity, if any, actually, in government to look at the nutrient composition of foods that are being produced and or imported. So, for example, someone who works with a group called the Sustainable Livelihoods Foundation has discovered that in the informal food supply sector, there are almost exact replicas of well-known brands. And if you look at the packaging, you will not distinguish the difference. I looked at Tastic rice, for example. There's just one tiny item on the packaging which is different. So, people are buying cheaper versions of well-known products which are not actually those products, which may not be a problem, but some of them do need to be examined to make sure they don't contain nasty substances like pesticides or other things like that. So this was discovered by a set of researchers. Government doesn't have the capacity to do that, or seems not to be focused on those kinds of issues.
The Department of Science and Technology has just brought out a draft white paper on science policy, and maybe one of the inputs should be actually about using science for regulation, because the policy is mainly about intellectual property protection, and so maybe that's a point to be made.
Some of the researchers don't necessarily regulate the drug company.
For sure. For sure.
So it's not necessarily that science would regulate, would be helpful in regulating the other industry.
Yeah, okay, but the science capacity in government to interpret data in order to regulate the drug companies is really important.
The one thing I think that worries me is the sort of unpredictable thing is the actor, the woman who comes home from work late.
Yeah.
And it's very hard to, and it's, healthy food can be expensive. And those kinds of things that are hard to manage.
Undoubtedly for the individual they are, but that's actually, for an urban metropole like Cape Town, it's about thinking about how you create food environments that don't make it the woman's problem to find the food coming home late at work. So transport should be more efficient, the food should be available, people can walk to a market, those sorts of things, safely walk to a market. Yeah,
you mentioned that there's been some successes, for example, in Mexico, the sugar tax. Are there any specific lessons we can learn with countries like that in terms of how we can implement regulations and so on?
So I think that's part of what this project is trying to unpack. I mean, we can look at the Mexican experience, which was a combination of sort of research evidence, political will, well-organized public health voice. But they can't simply be, imported here. The Brazilian public health system, the SUS, was a result of a sort of confluence of a political change, a very strong public health movement, a lot of evidence, and they created a very effective primary care-based health system. The South African government looked at that and said, we like this, we'll take this and this and this and this, and now we have the re-engineering of primary healthcare and the ward-based outreach teams, which are a sort of a shadow of what the SUS is, because it has no resources. It doesn't have the resourcing that the SUS has. So we can't easily sort of take lessons and just transplant them unless we understand context.
There are some really good examples of regulation done by New York City Health Department in terms of the food environment. So there have been some failures, of course. You probably know the famous failure where Mayor Bloomberg, who's a big capitalist, ironically, tried to regulate, they passed legislation which went through to regulate the size of sugar-sweetened beverages. You know, go to the US, can't just buy like a can of Coke. It's a quart. So that went through, and then the beverage industry overturned. They took them to court and overturned that ruling. However, notwithstanding that, they have a whole number of very interesting interventions, some of which include, for example, it's now mandatory for all food outlets and restaurants to have calorie boards. So as you enter the restaurant, all the meals have listed in large print what the calorie content of those meals is and what your daily requirement is and what your portion is of your daily requirement. They fast track as street vendors people who are applying for licenses and who are marketing fruit and vegetables and healthy things as opposed to burgers and so on. So they kind of jump the queue. They have regulations around schools that fast food outlets aren't allowed to set up within a certain perimeter of schools, and so on. So they've done what they can, but of course they aren't so easily able to regulate right at the top, which is where agreements under the WTO prevent very much regulation, which is a problem in South Africa.
Okay, I think we've come to 1 o'clock, so thanks everyone. Thanks David for chipping in. And if anybody wants any more information, I'm happy to share. Thanks.
Hi. My name is Michelle. I'm actually a student of Dr. Stalin's in Colorado. She told me I should look you up. Yeah.
Okay. All right. Well,
and I'm doing an internship this summer with Health Systems Trust.
Okay.
And as soon as I told her that, she was like, oh, there's this great guy named Leslie. You have to go and find him.
Okay,
and,
well, very nice. Okay. So what are you doing in Health Systems Trust?
I just started there this week, and we're working on a couple of projects.
Okay.
We're assessing competencies right now. I'm going on a trip to the Eastern Cape in a week or so.
Very educational.
Yes, so that should be an interesting experience to gather some data, and then I'm an epidemiology grad student, so I'm doing data work and everything.
Okay.
It's a very interesting presentation.
Okay.
Just worked out so well.
No, very nice. Well, when you speak to her next, say hi to me.
Okay, I will. Yeah, she told me to say hi to you. So.
Yeah. I think I need to switch something off, otherwise our conversation.
Thank you.
It's a big broadcast.
So, maybe she's awesome. PwC, I'm assuming.
I'm part.
Thank you. And the 15 application, or you still working? Good.